Good morning. I'm Dr. Ashraf Elazab. Dear Chairman and colleague, we will shift a little from knee and shoulder arthroscopy to open-wedge high tibial osteotomy. Open-wedge high tibial osteotomy is a successful technique which could prevent a major complication or a major operation later on, especially in young patients. In patient with unicompartmental, medial unicompartmental knee osteoarthritis, especially with a metaphyseal varus. I will present about open-wedge high tibial osteotomy using our specially designed protective cutting system to avoid the intraoperative complication. This is my disclosure. I have nothing to disclose. All of us know that high tibial osteotomy is an attractive option for the medial unicompartmental osteoarthritis because the knee joint is preserved and the result is excellent pain relief and improvement of function. Also, open-wedge high tibial osteotomy offer a numerous advantage over the lateral closing wedge procedure and it gaining a popularity. However, open-wedge high tibial osteotomy is also associated with a potential intraoperative complication, like tibial plateau fractures, like dislocation of the osteotomy hinge, under or overcorrection of the posterior slope, neurovascular injury, which is the most dangerous complication, irregular cutting surface and breakage of the medial cortex. And the plan of osteotomy also could be changed during a manual cutting of the posterior cortex. Sewing is usually performed with a freehand technique using two key wires guided to the head of the fibula, and we usually used a free technique to doing the posterior wall, medial and posterior wall cut. The majority of osteotomy is performed with an osteotome because of the fear of the neurovascular injury except for the medial cortex. And for this reason, sometimes incomplete osteotomy could be done at the posterior cortex, which could affect or increase the posterior slope and could also cause a tibial plateau fractures. For this, problems or previous potential complication in South Korea with my previous professor, we designed a special protective cutting system to be used during high tibial, open-wedge high tibial osteotomy. The device is formed of two pieces. This one is a releaser and the second one is the major cutting block or the protective cutting piece. And we can see here also the saw can pass easily through the cutting block with a posterior protection to protect the neurovascular structures. The releaser is used for the easy access to the lateral cortex of the proximal tibia from the posterior medial corner through the posterior wall of the proximal tibia. And the protective cutting block, which composed of two pieces, and we can see it's composed of a cutting block and a protector. This protector usually pass posterior to the posterior wall of the tibia to protect the posterior neurovascular structures. The protective cutting system function, the first is you can complete one plane sewing of the posterior wall prior to the lateral hinge. And also you can protect the posterior neurovascular structure. And the third and last one is bone cutting along the natural tibial slope. Simply the technique, the usual longitudinal posteromedial incision, then incision over the base incernus, releasing the base incernus and insert the releaser as we see here, The releaser have a special curve to pass easily to the head of the fibula. Then the protective cutting block or protective cutting piece is inserted with the head. We can see here in the C-arm or the X-ray that the head, the protective cutting piece is directed to the head of the fibula. And we can see here, you have to take a lateral view to adjust the slope. As we can see here, the slope is, you can control the slope easily by lifting your hand up or down. And also you can direct the protective cutting piece to the head of the fibula easily. Then you can easily pass the saw through the cutting block and to the piece, the protective cutting piece. So you can easily do your cut in one plane without any risk. This is a C-arm picture with the saw is inserted in place. This is a laminar spreader usually inserted as the most posterior part of the osteotomy. And then start to fix the osteotomy site with your preferred plate. And this is the final picture. I just want to say that this device could make your operation accurate with less complication. However, it's a very easy piece which can easily fabricated. So we think that this protective cutting system would give technical advancement for the accuracy of osteotomy and avoiding intraoperative complication. Thank you.